In this lesson, we are looking at controlling the spread of disease. Here are our dot points. There's 3 of them. All right, let's talk about strategies to control disease spread. So there's many techniques to managing the spread of disease, and there are personal and community measures that need to occur simultaneously to ensure that disease transmission is controlled. Right, we know about washing our hands, and we are currently very familiar with physical distancing. And what we're aiming to do is keep as many individuals as healthy as possible, whilst also balancing the capacity of the healthcare system that does look after us. So if we're talking about personal measures, we are talking about hygiene in particular. So hygiene is the conditions or practices that are conducive to maintaining health and preventing disease, especially through cleanliness, right? So we have individual responsibilities. It's about individuals taking action, and that leads to community benefits. Now, individual actions might be talking about hand, body, hair washing. Interestingly though, with soap and clean water, not always accessible to everybody. We want to minimize coughing and sneezing on others, absolutely. Cleaning items when you touch when you're ill. Disposing of tissues and other pathogen carriers, using protective barriers like gloves, masks, and even condoms if we're talking sexual contact there as well. So while this all may seem very, very mundane and obvious, you've got to consider that your geographic location plays such a huge part in this. So when I mentioned, say, the clean water, very accessible to us, not so much for other people in, say, developing nations, or even things like refugee camps or war-ravaged regions, natural disaster zones. There's a whole lot of opportunities for those to be all about disease transmission. All right, let's start talking about hand washing. It is a primary preventative strategy, and some estimates say that around 80% of infectious disease can be spread via hand transmission, hence why I give you sanitizer. So obviously we need to wash before and after food, medications. I have to wash my hands with before and after contact lenses, right? Rubbish, blowing your nose, all those kinds of things that we are familiar with. It has to be done in a lot of different places. So if we can't have access to a sink, you might need to have personal hand sanitizer on you. And it needs to be done with soap or disinfectants, and it needs to be done for an extended period of time so it's thorough. If we talk about hygiene etiquette, we're talking about sneezing and coughing away from other people. So you often see these signs, so dab, which means destroy all bacteria, so sneeze and cough into your arm. So the etiquette can mean many, many things, and these kinds of etiquettes are really important in hospitals as well, where many vulnerable, sick, immunocompromised people are together. We have to minimize the possibility of getting a hospital-acquired infection. So we have to ensure the good practices are in the community, but also in those hospitals. Now, interestingly, some countries have these habits ingrained culturally. So many Southeast Asian nations regularly wear masks when experiencing cold symptoms, simply to avoid spreading pathogens from themselves or getting them from others. So many cultures are more community-minded than we are. It's assumed that anyone could be a carrier of a pathogen, even healthy people. So in the spirit of that solidarity, you need to protect others from yourself as well. All right, let's talk about travel etiquette. So when you travel, obviously leads to exposure to new bacteria, new pathogens. So even changing schools, you get new kids, new bugs essentially. So we have to use preventative medicines and vaccinations before we go and travel. Hand washing and hygiene etiquette should always apply in this situation. And you should be also taking cues from who is around you and what they might be doing. So you want to use preventative strategies as well. So if you're going somewhere where there's malaria that's endemic, you want to keep the vectors away from you. So you want to use insect repellent, really simple. So those cautious behaviors around eating food, drinking water, and you might need to go to a place where you've got to boil the drinking water because it's not safe. All right, so let's talk about community actions now. Now, we know that individual actions are amplified in the community space, and if we're all individually maintaining good personal hygiene, this will impact community health as a whole. So there's various strategies which are usually occurring in the background that we've really only been brought to the forefront now, but they're happening all the time, and because they're in the news cycle, we kind of know about them now. And they may seem really, really familiar, but remember, our current awareness is so heightened. So individual actions add up to community health, and the strategies are in place, are familiar to us now. All right, let's talk about contact tracing. This is a first strategy employed when some kind of disease becomes endemic into an area, so during those outbreaks. And it's used to identify and monitor infected individuals and their movements to determine who or what they have come into contact with, either directly or indirectly. So tracing individuals allows early intervention to minimize spread, and it's a crucial part of epidemiology, which is the study of the spread of disease. So we've got the COVID Safe app, but contact tracing can be done in many different ways, and it's really difficult when a disease can be asymptomatic. And if the R0 is increasing, contact tracing is a lot less effective because there's a lot of community transmission occurring. Now, if there are mass gatherings, we tend to restrict them, obviously. So we're talking mass gatherings like sporting events, religious worship, entertainment, workplaces, schools, anywhere where a large number of people congregate and are in close contact. So they can be banned altogether, but if that's not practical, school, workplaces, all those kinds of things, we need to take practical measures to reduce the risk. So we use mathematical modelling to plan and predict these kinds of things, particularly using the R0, and the strategies to minimise them are all about this infrastructure that's around, or even surveillance. And when I talk about surveillance, it's not just putting cameras on everybody. It might be that you go to a restaurant and you get your temperature screened. It might be that you then need to scan a barcode to check the menu, all those types of things. So these are some interesting pictures. The Hajj is a pilgrimage to Mecca, and this happens every single year. Usually around 2.5 million people do it. This year it was restricted to 10,000, so they're usually shoulder to shoulder. This year they're all 1.5 meters spaced apart, and they're talking about bringing music festivals and concerts back in a physical distancing sense and limiting the numbers. All right, temperature screening happens at borders, or it can happen in a more local sense during outbreaks. Like if you go into Uniqlo at the moment, they do a temperature check for you, right? So this can be pretty standard during international travel at borders, but it's currently coming into our day-to-day. So increased temperatures can be a sign of infection if there's no other symptoms present. Screening at airports became pretty standard during, say, SARS, MERS, influenza, bird flu, swine flu, all those kinds of outbreaks. An increased temperature can be due to the increased metabolic activity due to our white blood cells, dilation of blood vessels, and fever can be felt at the skin. Our skin temperature can range from 31 to 37, depending on the part of the body that's being impacted. So you might be really resting that day, or you might have a lot of clothing on. All right, if we are talking community transmission, we're still talking quarantine and travel restrictions. So we need to isolate those infectious individuals at home or in a hospital. Now, obviously we want to avoid the spread to communities, but if we're talking quarantining, it's not just about the individual. We can be talking about different fruits, foods, organisms that cross borders. So you know that in Australia, border quarantine is really strict, but at the moment we also have border closures just to completely prevent this from happening. In order for us to evaluate the best strategies, we have to take a number of different things on board. So we need to consider firstly the pathogen type, the R0 value, how severe the disease is, and how easily the public will uptake these strategies for preventing the transmission. And obviously we need to take on board really current information as we go. Okay, we know that in order to flatten the curve so that we can keep our healthcare system in capacity, you need to consider all of these things because it changes on a daily basis. We do use mathematical modelling to model the spread of disease so we can take on board a lot of these kinds of factors, like the availability of healthcare in certain regions, the incubation time of the pathogen, the R0, and the demographics. So you're talking high density housing areas, public transport, and distance travelled. This is a really interesting graph that came out recently that was a prediction to say, hey, if only 70% of the people in our community comply with physical distancing, what is our curve number going to look like, or active cases of COVID? But if we have, say, 90% uptake or compliance, look at this blue curve there. So very, very different story. There are our dot points. Sorry, this one goes on for so long.